Okay, good morning, everybody, and good afternoon. Welcome to this next hour with KFF. I'm Drew Altman, the KFF CEO, and today we're talking about COVID and what we've learned from the vaccine monitor. I know you see us doing lots of different things on COVID. That's because when COVID hit, we pivoted as much of KFF as we could to take it on. That means our policy analysis and our polling and Kaiser Health News and our information campaigns, creating greater than COVID and the conversation campaign. But one core element of that has been the vaccine monitor, and that's what we're talking about today. The idea was to monitor vaccine hesitancy. Some people prefer confidence, but even more than that, people's experiences getting the vaccines and with COVID generally, beyond vaccination, and through the rigorous methodological approaches we use to be able to speak confidently, and this was important to us, to the attitudes and also the experiences of Black Americans and Latinos and seniors and low-income Americans and rural Americans, and look at the response to COVID and to vaccines by political party. We didn't really want to do one-off polls, just as we've done. I know many of you are familiar with this, with our ACA tracking poll, which we've done since the beginning of the ACA. We thought it would be important to track monthly to identify trends and changes, and that's why we called it the monitor, and that's why we established a dashboard on kff.org where you can see the trends and you can see the results. You can see pretty much anything you want to see about attitudes and experiences with COVID and vaccines. Looking beneath the top lines, that really did turn out to be consequential, as there are unique stories to tell about the Latino community and their experiences with COVID, and the African American community. And as you are no doubt aware, whether you are a Republican or a Democrat is the strongest predictor of vaccination, and also clearly differentiates where you stand on the seriousness of COVID, on masking, on boosters, on lots of things. In my judgment, kind of a sad state of affairs. One exception, exhaustion with COVID. That's bipartisan. And we can debate what mixture of Donald Trump and misinformation and disinformation has produced this, but the result is a response to a national emergency compromised by a partisan divide. I was actually thinking this morning when I was getting ready for this event that the US is in the low 60%, I think approaching 64% on vaccination, and the developed European countries we often compare ourselves to are in the mid to high 70% range. And all of them have anti-vaxxers. They all have a right wing. Some of them have a virulent right wing. They all have disinformation, just like we do, or a sharp partisan and ideological divide on COVID. That may be the difference, and what explains the lack of solidarity on COVID, as Klein wrote about in the New York Times the other day. Because our lack of solidarity on COVID, it's not randomly distributed, it turns out. It's distributed largely by political party. At about the 2-year mark, what we will do today is highlight the most salient lessons from our vaccine monitor report, and Liz Hamill's going to do that and the overview of what we've learned. We will then focus in on parents and kids, which is and should be a currently hot topic, and Luna Lopes will handle that. And then Molly Brody, who leads our polling work, will hit some of the key points about public opinion and COVID policy, and then we'll open things up. We're not going to devote a lot of time to the political implications at this stage, since that's really prognostication about unknown future circumstances with COVID. We hope there won't be, but will there be another variant with inflation, with Trump and whatever he is up to, with the Ukraine? But if you want to get into that, I'm happy to get into that as well when we get to the Q&A. And lastly, just some housekeeping details. The briefing is being recorded, and the link to the recorded version and the slide presentation, we will mail that to all of you. And you can submit your questions through the Q&A function during the presentation and when we get to the questions as well. So first up is Liz Hamill, and I'll turn it over to Liz.
Thanks, Drew, and welcome to our audience. Drew gave a great overview of the Vaccine Monitor project, and so I won't spend too much time on this slide, but you can see some examples of the types of questions we've been tracking here. Just methods-wise, these surveys use probability-based sampling with interviews conducted in English and Spanish, and we include oversamples of Black and Hispanic adults to make sure we can speak about the experiences of some of the groups that have been disproportionately affected by the pandemic, as Drew mentioned. And in some months, we've included oversamples of other important groups like parents, which Luna will present in a few minutes. You know, the big picture goal of KFF survey work is to make sure the voices of real people can be heard in health policy debates. And in the case of the Vaccine Monitor, our goal is to get this information into the hands of anyone who can use it to help address people's concerns and information needs to help individuals make decisions that can protect themselves, their families, and their communities. So here on this slide, you see the main question we've been tracking in every survey since last December, looking at people's vaccination status and their intention to get vaccinated. And this question divides people into 5 categories. The shades of blue are those who've gotten at least 1 dose of a vaccine, say they want a vaccine as soon as possible or want to wait and see before getting it. And then the green bars are those who say they'll get vaccinated only if required for work, school, or other activities, or they'll definitely not get vaccinated. So first, the general trend, you'll notice the steady growth in the dark blue bars up until the early summer of 2021, when vaccination rates seem like they might be stalling out at around 2/3 of adults. That first red arrow marks the Delta surge when there was a bump up in vaccination from 67% to 72%. And I should mention, I think Drew said earlier, we were in the 60s. That's if you look at the whole population, but these are surveys of adults. So we're looking at the rate among adults. And then, you know, we saw again, vaccination held steady for a few months before bumping up to 77% in January amid the Omicron surge. So what this suggests to us is that when we see increases in cases and hospitalizations, it has been a motivator for some more people to get vaccinated. Another thing to notice on this slide is that the increase in the dark blue bars has come largely from a decrease in the as soon as possible and the wait and see groups over time. What really hasn't changed in any meaningful way is the size of that group that says they'll definitely not get vaccinated. It was 15% in December 2020, and it was 14% last month, with no statistically significant shifts in over a year. So if we go to the next slide, you know, one question we ask is what has made a difference for those who were initially hesitant and ultimately decided to get vaccinated? So we did a survey in June where we re-interviewed people who told us in a previous survey that they were on the fence or they were wait and see. And we asked them what changed their mind or persuaded them to get vaccinated. This was more of a qualitative project, and you can see some of those open-ended responses here. But what really stood out was the influence of personal interactions with doctors and with family and friends. So some people said that they had the chance to discuss the vaccine with a doctor they already had a relationship with, or with a friend or family member that was a healthcare provider. Others said they became more comfortable after seeing people around them get vaccinated with tolerable side effects. And some people were motivated because they wanted to protect their family or visit with family members, or they were directly persuaded, or as you see here, even bugged into getting the vaccine. We also learned in our September survey that personally knowing someone who got seriously ill or died from COVID during the Delta surge was a big factor in motivating people who initially held out on getting a vaccine. And again, that's an example of the importance of personal connections in making this decision. If we go to the next slide, we're looking here at vaccination rates and intentions for different subgroups of the US public. And before I talk about who is at the top and the bottom of this list, I just want to acknowledge 2 things. First, across all of these groups, at least half of adults say they've gotten at least 1 shot of the vaccine. And then second, none of these groups is monolithic. So in each segment of the population, there are many people who are vaccinated, some who say they're waiting to see, and some who say they'll definitely not get the vaccine. But when it comes to who is most and least likely to report being vaccinated, the biggest dividing factors at this point are age, party identification, and education, with geography and religious identity playing a role as well. So at the top of the list, the largest shares saying they're vaccinated are among Democrats, older adults, and college graduates. And then at the bottom, we find lower self-reported vaccination rates among Republicans, white evangelical Christians, and rural residents, and those without college degrees. Now, if we go to the next slide, you'll notice that I didn't point out differences by race and ethnicity in the previous slide, and that's because currently we find roughly equal shares of Hispanic, Black, and white adults report being vaccinated. But that hasn't been the case throughout the entire vaccination effort, and so I want to point out some key points in the time trend on this. So the first red circle there is in April 2021, and you'll see then that the share of white adults who reported being vaccinated at that point was higher than the share of Black and Hispanic adults. And at that time, we found that Hispanic adults were significantly more likely to put themselves in that as soon as possible category, and both Black and Hispanic adults were more likely than white adults to say they wanted to wait and see. We also found that Black and Hispanic adults at that time were much more likely to cite access barriers to getting vaccinated, like not having paid time off of work, not having a trusted place to go to get the vaccine, and in the case of Hispanics, concerns related to immigration status or needing to provide documentation to get a vaccine. So rather than just being an issue of so-called vaccine hesitancy, we found that access barriers and historically poor treatment by the health system were playing more of a role in these early disparities. Now, the second red circle here is showing that by September, we found a narrowing or closing of the racial and ethnic gap in vaccination rates among adults. And finally, if you look at the bottom at the green lines, those are the share of each group that says they'll definitely not get vaccinated. We currently find that white adults are significantly more likely than Black or Hispanic adults to put themselves in this category. If we go to the next slide, you'll see the trend by vaccination attitudes by partisan identification is much more straightforward. Those partisan gaps emerged early on, and since basically last spring, Democrats have been 20 to 30 percentage points more likely to report being vaccinated compared to Republicans, with independents falling in the middle, and a pretty consistent share of Republicans, around 1/4, saying they will definitely not get a vaccine. If we go to the next slide, another important topic that has come up in the vaccination effort is misinformation. We did a report on this in October where we tested 8 different false or misleading statements about COVID-19 and the vaccines. And these statements included things like government conspiracies suggesting that the government is deliberately hiding vaccine-related deaths or inflating deaths due to COVID. They also included some blatant falsehoods like the vaccines contain a microchip or they can give you COVID or change your DNA. One thing that we learned in that survey first is that belief or uncertainty about misinformation is common. About almost 8 in 10 people had heard at least one of these false statements and either believed it to be true or were unsure if it was true or false. So a fair amount of confusion. And 1/3 of the public either believed or were unsure about 4 or more of the 8 statements we tested. Now, notice again the political divide, with Republicans much more likely to believe or be open to believing this type of misinformation compared to Democrats, but also the correlation with vaccination status. Fully 64% of those who haven't gotten vaccinated were open to believing 4 or more pieces of misinformation. Now, this really shouldn't come as a surprise given the polarized US media environment and the quickly evolving science around COVID and the vaccines. It can be hard for the average person to keep up, but it really does underscore the huge challenge of helping people navigate what's true from what's false when it comes to making decisions about vaccinating themselves and their families. On the next slide, beyond partisanship and misinformation, we found a few other key attitudinal variables that are strongly associated with being unvaccinated. One is the sense that the pandemic is just not that serious. So 70% of the unvaccinated say they believe the news media is exaggerating the seriousness of the pandemic, and 3/4 say they're not personally worried about getting sick from COVID-19. When we ask if getting vaccinated for COVID should be a personal choice or more part of everybody's responsibility to protect the health of others, the unvaccinated overwhelmingly say it should be a personal choice. And finally, there's a sense among the unvaccinated that the vaccines are not safe. 7 in 10 say they're not confident the vaccines are safe for adults, And over half actually believe that getting the vaccine would be a bigger risk to their health than getting infected with the virus. So on the next slide, if we think about a path forward with the unvaccinated, we asked those who hadn't gotten a vaccine as of December, what, if anything, would convince them to get vaccinated. And the most common response offered by about half of this group was nothing. Now, there are still some who say they're holding out for more research or transparency, and some who say they'll get vaccinated if it's mandatory for their job. But it's clear that as the persuadable have become persuaded, we're increasingly left with an unvaccinated population that is largely made up of the intractable, definitely not group that has really dug in their heels against getting a vaccine. Finally, on the next slide, the next big vaccine push is with boosters. And so we're tracking that in these surveys as well. Here we show this two ways. So on the left is the share who say they've gotten a booster among the population that's eligible. So meaning people who completed their full initial course of vaccination more than 5 months ago. And we see that among this group, booster uptake is relatively high, with 70% saying they've gotten a booster as of January, and even higher shares among older adults. You'll also see that the partisan division here is somewhat smaller. So among those who are eligible for a booster, 79% of Democrats say they've gotten one versus 67% of Republicans. So that is a difference, but it's not the huge difference we saw in initial vaccine uptake. And this suggests that once you've made the decision to get fully vaccinated, partisanship may be playing less of a role in the decision to get a booster. We do see some early signs of racial disparities in booster uptake, with eligible Black adults less likely to report being boosted compared to white and Hispanic adults. And this is something we'll be keeping an eye on in future surveys to see if this relates to access barriers or other factors. And then finally, if the left half of the chart here is the glass half full, the right half, maybe the glass half empty interpretation, this is what the booster looks like as a share of all adults. So even though 70% of eligible adults have gotten boosted, that's still only 42% of the total adult population. And the differences by age, race, and party are also magnified. So for example, among all adults, Democrats are about twice as likely as Republicans to be both vaccinated and boosted. So with that, I will turn it over to Luna, who will talk about what we know about parents' attitudes towards vaccinating children.
Great, thanks so much, Liz. And so when looking at where we are with kids and how we got there, this really is almost a tale of two age groups, right? Since teens were first had access to the vaccine earlier than the 5 to 11 age group. So as we look at the slide here, what we see is that there's been an increase in the share of 12 to 17-year-olds who have said that they, whose parents say that they have their child's vaccinated. So that jumped up from November. Now, what's kind of notable here is that when the vaccine was first made available to this teen age group, what we saw was, a steady uptake in the spring and summer of last year, and then kind of a plateau in the fall. And, and so from September through November, the share of parents who said that their teenager had been vaccinated was in that upper 40s range. So following, Omicron and also the availability for the vaccine to that 5 to 11 age group, what we saw was an increase among parents who say their teen has gotten the vaccine from November to January. And when we look at the younger age group, the parents of 5 to 11-year-olds, we asked here in November, right when it was first kind of available to that age group, whether their child had been vaccinated or not, and what their intention was if they hadn't been. And really what we saw was that 16% of parents of 5 to 11-year-olds back in November said that their child had already received at least one dose of the vaccine. And that jumped up to 33% in January. And really, even though these two age groups, one's following the other, given just when the vaccine was made available to them, what we see is a very similar pattern, that when the vaccines are first eligible or made available to these kids, the parents who are really eager, who say that they want to get their child vaccinated right away, are going out and doing so and taking their child to get vaccinated. And then the parents who are in that wait and see category, they kind of have been seeing how those eager parents and children, the vaccine works out for them. And so we see that number of parents who are in that wait and see category slowly decreasing. And what we don't really see is a big decrease in the share of parents who say they'll definitely not get their child vaccinated. So that has stayed relatively stable in these two groups of children. So if we move on to the next slide, now with Pfizer recently asking for emergency use authorization for children, for their vaccine for children under the age of 5, we've been asking parents what their intention is to get their child under 5 vaccinated. Oh, sorry, next slide, please. Right, there you go. And what we see is that, again, a similar pattern here that we've been noticing with the other age groups. In fact, parents of children under 5, right now in our latest data from January, their attitudes really mirror where parents of 5 to 11-year-olds were before the vaccine was made available to them. So we have about 3 in 10 who, parents with children under 5 who want to get, who are eager and want to get their child vaccinated right away once that's available to that age group. And a similar share who are in that wait and see category and want to see how other young children do with the vaccine. And similarly, we have, a quarter of parents of these young children who say that they will definitely not get their young child vaccinated. And what we've seen in the older age groups is that those parents are really hard to move there, and they tend to be very fixed in their attitudes towards the vaccine for their children. And if we move on to the next slide, what we see is that when we ask parents, about their, why they haven't gotten their eligible child vaccinated, safety concerns are really something that comes out when we ask them in their own words to tell us why they haven't gotten their child vaccinated. And here we see that parents are less likely to have confidence in the safety of vaccines for children, especially younger children, with a majority saying that they're not too or not at all confident that the vaccines are safe for children in that 5 to 11 age group. But compared to the share who say that they have confidence that the vaccines are safe for adults, we see that fewer parents say the same for even teens and definitely for that younger age group of 5 to 11-year-olds. If we move on to the next slide, we see that while safety concerns are really, kind of widespread among parents who haven't gotten their child vaccinated yet, those aren't the only concerns that parents have to deal with. And some parents have, other issues in terms of access to the vaccine that they're also concerned about. So we asked, parents whether they're concerned that they might need to take time off work to bring their child to get vaccinated or care for them if they have if they experience side effects from the vaccines. And what we found was that Black and Hispanic parents and parents with lower household incomes, were more likely than their counterparts to say that this is a concern for them. And similarly, we also asked, how concerned these parents are about being able to get the vaccine from for their child from a place they trust. And we think that this is a particularly important issue for children, since as I'll show later, a lot of parents really do trust the pediatrician, and not all parents have access to a pediatrician. And and there is this concern among certain parents that they're not going to be able to get the vaccine for their child from a place that they trust. So we saw that again, that Black and Hispanic parents and those with lower household incomes were more likely to say that they're concerned that they won't have access to the vaccine for their child from a trusted place. And we also asked about the difficulty of getting their child to a vaccination site. And again, here we see that for some parents, this is a bigger concern than for others. Again, Black and Hispanic parents, and particularly low-income parents, say that this is something that they're concerned about. Next slide, please. I think other way. Yeah, thank you. Next slide. There we go. As I mentioned, parents have a lot of trust in their pediatrician. So we asked parents, who do they trust to provide reliable information about the COVID-19 vaccine? And here we see that pediatricians were really the only source of information that we asked about that had, trust across parties. So we see that even among Republicans, there's a strong level of trust on pediatricians. And here, what we noticed, though, is that when we ask parents if they've spoken to their pediatrician about about the vaccine and getting their child vaccinated, many parents have not actually spoken to their pediatricians and discussed the vaccine for their child with their child's doctor. And so this is something out there. There's an opportunity as parents take their kids to their annual physical, and as school starts, the new school year starts, these are the kind of conversations that will make a difference for parents, since there is a real strong level of trust among towards pediatricians among parents. And finally, in our next slide, we see that it's not just pediatricians that can play a role here in encouraging parents to vaccinate their child. When we asked, whether schools had encouraged their parents to vaccinate their child, what we saw was that among parents who say that their school did encourage them to get their child vaccinated, they were more likely to have a vaccinated child. So not only did we, see this, but when we controlled for other factors such as, education, race, income, partisanship, and even the parent's own vaccination status, a school having encouraged, parents to vaccinate their child, that still was a notable difference there, that they were more likely to have a vaccinated child if they had that encouragement from the school. So that's kind of where we're at right now with, the role of vaccine uptake among children. I'll now kind of pass it off to Molly and Brody, who will cover the, state of the politics and the policies that we're trying to pass to address these, the current vaccine status.
Great. Thanks so much, Luna. So what I do want to do just to end this presentation is a look at some of the other aspects and implications of the pandemic that we've also been tracking through the monitor, and share a few thoughts about what it might mean going forward. So next slide, please. First, in addition to looking at the dynamic nature of the vaccine uptake, we've also been tracking the impact of the pandemic more broadly on families, the financial impacts, mental health impacts, the concerns about educational situations, all those sorts of issues. What we see here is that 4 in 10 adults say that the pandemic has had a negative impact on their ability to pay for basic necessities like housing, utilities, and food. And given the robust oversamples that Liz described at the top of the presentation, we can track how these continuing disproportionate impacts of the pandemics are affecting different subgroups in America, including people of color and people who have lower income. So while Liz had shown that disparities in vaccine uptake have closed over the course of the vaccination effort, what we see here is that these broader impacts, particularly in terms of being able to pay for basic necessities, continue to have a disproportionate effect of people of color and low-income populations. You see that Black and Hispanics are much more likely to say that they're having trouble paying these basic necessities because of the pandemic, as are the lower income households. Turn to the next slide, please. We've also used the monitor to understand opinions about prevention and mitigation strategies and policies, like requirements to get vaccinated or vaccine mandates. We've looked at this across different settings, vaccine mandates for schools, for healthcare workers, for mask mandates. And what we're showing here is vaccine requirements for various travel scenarios. And we'll note a pattern that is consistent across every mandate that we've asked about. And that's that overall, about half the public thinks it's a good idea to implement these sort of mandates. Here you see 6 in 10 think it's a good idea to require vaccination for travel internationally. About half think it's a good idea, or they support this sort of requirement to travel within the US. But what we see across both these questions and all the others I just mentioned is big differences by partisan identification. So Democrats are much more likely to agree with these requirements than are Republicans. And these gaps are almost 2 to 3 times the difference. And as I say, this is true when we ask about mask mandates, when we ask about mandates for schools and for healthcare. If we turn to the next slide, I'm going to show you another example. This is in terms of a policy that the Biden administration has put forward that requires employers to make their large employers, make sure employees get vaccinated or get access to weekly testing. What you can see here is that the public is somewhat split on this. About half support this idea, about half, 45%, are opposed to it. But again, we'll notice the large gaps between Democrats and Republicans. About 86% of Democrats support this idea. That falls to 18% of Republicans, less than 1 in 5. Now, what I will note is that in our surveys, we've asked people if they themselves are subject to policies like this. And in fact, 3 in 10 employed adults tell us that their employer already requires them to be vaccinated or get weekly testing. And that share rises if the employee works at a larger employer. So regardless of opinion or the current state of the Biden policies in the courts, many employees are already subject to this. And I think this raises one of the big implications as we think about what the pandemic has taught us about going forward. And let's look at this on the next slide. So like we saw with the case of schools, workers are more likely to tell us that they're vaccinated if their employer provides them paid time off to get vaccinated, or if their employer had encouraged vaccination among the workers. And again, just like we saw in the schools, these results hold even after we control for a lot of other factors that we know predict vaccination status. So employers' efforts and schools' efforts matter to the nation's vaccination rates, with or without these broader policy mandates in place. And I think this is a key implication going forward. We turn to the next slide. Similarly to the political polarization that we've seen in terms of pretty much everything related to the pandemic, we found that it spread very quickly in terms of trust of public health officials and agencies. So note here the gap in the last 2 columns between Democrats and Republicans in terms of their trust of information about COVID from the CDC, from the FDA, from Dr. Fauci. Those shares differ by 30 to 50 percentage points, which is a huge gap in opinion. And these gaps grew over the course of the pandemic. If we turn to the next slide, though, we have to combine that with the fact that, as Drew said at the beginning, we know that across partisans, people are tired. They're fed up. They're frustrated with this pandemic. 3/4 tell us that they think it's inevitable that most people are going to get COVID. But these attitudes and opinions are playing out differently for what they think is the most important issue for the country to be focused on right now. For Democrats, it's still the pandemic. But for Republicans, it's inflation and rising prices. We turn to the next slide. What this means overall is that we've seen this political polarization that Drew laid out at the beginning play out in terms of vaccine uptake, play out in terms of vaccine attitudes and opinions, and certainly in terms of trust in public health officials and in terms of priorities. And what we can take away from all this data, turning to the final slide, is a few lessons here. The first one is that we believe that most of the low-hanging fruit, so to speak, has been picked in terms of vaccination uptake. I think further efforts to convince those dug in, definitely not people, are going to be hard. They're going to need to be hyper-personal approaches. What we also have learned is that while physicians are a very trusted source of information, and while the mandates are really politically divisive. It's policies from employers, from schools, things like providing the paid time off, encouraging parents to get vaccinated, encouraging their employees to get vaccinated, that can really make a difference to our overall nation in terms of the vaccination rate. On the other hand, the political polarization and the misinformation, some of which Liz laid out, is a huge challenge going forward. And when you combine that with the declining trust in our public health officials and healthcare experts, we really need to think hard about this in terms of the implications. When you think about something like a pandemic where the science is changing over time and we're learning, and where different people have, even public health officials have different views and opinions about how they interpret the science and what mitigation strategies are necessary or not, like mask mandates, like other aspects, it creates an environment with an enormous amount of confusion for the average American. We've measured in our polls how difficult it is for people to assess what they should be doing if they are exposed to COVID, if they should be wearing a mask, what tests they should be taking, what they shouldn't be taking. The declining trust, the misinformation, the political polarization makes that kind of communication even tougher and really puts a higher burden on our public health officials and all communication efforts to try to help educate and help people make decisions of how they mitigate the risks in their own lives. Lastly, as we said, and I'm sure many of you feel, we're all tired. We're tired, and this pandemic fatigue may play out for different groups. What does getting back to normal mean? Does it mean removing all the mitigation measures like we've seen in some blue states recommending recently? Or does it mean doubling down on the mitigation measures to reduce the threat of COVID as much as possible? I think these are really the questions going forward. And I think the declining trust, the political polarization, the difficulty of knowing how to weigh the differing messages about what to do and what not to do are all going to lead us to what will continue to be a lively debate going forward. And with that, I'll turn it back to Drew to moderate a conversation between us and to answer some of your questions. So thank you all.
Am I back? I think I'm back. Okay, thank you all. That was a lot of stuff. We have a lot of questions. On Molly's last point, I think it was Casey Hunt who tweeted, well, who are the people who are not tired and frustrated? Which we actually have some speculative answers to, but I'm not going to start there. I'm going to start actually with sort of a theme we've been hitting and then move away from that theme, which is the impact of party and partisanship. Because I will start with a question we got from the AP, which the question is basically, are we seeing the same impact of partisanship on parents' views about vaccinating kids to the same degree that we saw it in adults' views on getting the vaccine themselves? Or is it different? Is the magnitude different? Is it the same or is it different? Who wants that one?
I can take that one. Yeah, I think we are seeing those similar partisan splits when we look at parents. I think one thing though that I'll just mention is that since we know that there is that split on people themselves getting vaccinated, so adults themselves getting vaccinated, there's a large partisan gap there. What we see with parents is that because vaccinated parents are more likely to have vaccinated children than unvaccinated parents, we're seeing that partisan element also play in there. But I will just highlight that there are, even among vaccinated parents, they're a bit more cautious when it comes to their kids. So among vaccinated parents themselves, there is, a notable share that are still in that wait and see, or especially when the vaccines are first available for an age group, that they're still in that wait and see group. And so as they wait and see how kids in those age groups are doing, we see that share shrink. But even among vaccinated parents themselves, there is an additional layer of kind of caution that we are seeing in the data that they have when it comes to vaccinating their children. And so, and a lot, so that includes Democratic parents who are vaccinated and, are a bit more cautious when it comes to whether or not they're going to vaccinate their child.
Speaking of the kids, another question we got, I don't think we have asked about this, but I'll just ask, is whether we have seen any change during the COVID controversies about COVID vaccination and attitudes towards other vaccinations, the standard childhood vaccinations and other vaccination.
Yeah, it's a really great question, and we haven't been able to tackle that yet. We have been able to look at parents who are sort of already what you might consider anti-vaxxers, or parents who are prone to delay other vaccines for their children. And as you might imagine, those people are the least likely to be getting their children the COVID-19 vaccines. But I think there is a lot of concern out there. We can also look at we've asked people if they normally get a flu shot, and we find that, again, people who say they normally get a flu shot are much more likely to get a COVID-19 vaccine. So there's some correlation there, but I think we haven't yet been able to figure out if the controversy over the COVID-19 vaccine is in a measurable way bleeding over to decreased confidence in vaccines more generally.
Okay. Another question we got is about the role of governors, which is close to my heart as a former state secretary of human services, that is the question, basically the outsized role that governors have played. President Trump delegated principal responsibility to governors for the response to COVID, then urged many governors, particularly in the red states, to go slow, back off, and deny. That helped split the country, leading us to where we are today. But what have we seen in our polling, or could you speak a little bit to what we have seen in our polling about the public's views of the role their governors are playing, trust in governors? I think also state health officials is part of that picture as well.
Yeah, I'll take this. I mean, what we know always and historically about public opinion is that the more local you go, the more trust you have, right? So people have more trust and more faith in their local schools, and they think about the state schools or the nation's education system. We certainly know that's the case in terms of our data, and we've been asking about trusting information about the public officials, the federal officials versus state officials versus your local health departments. So we know that there's sort of an inherent bias that people have about their local communities and the states that they live in. So that certainly has played out in terms of the pandemic. But, you know, I think that you can't underestimate this effect of where you stand in terms of your partisan identity and the media sources that you go to. And that also has an impact on whether you have trusted or appreciated the role your governor has played. So if you agree with your governor politically, you're more likely to have agreed with your governor in terms of the choices they have made regarding the COVID pandemic than you do if you don't agree with your governor politically.
Yeah, that's the point I was going to make. A series of questions. They're kind of on a similar theme because it's what we found in the survey research. We have emphasized partisanship and the partisan divide a fair amount. So one question was, well, what about education as an independent factor driving attitudes and behavior with regard to vaccination and all the COVID issues that we have looked at? What, for example, about Democrats who do not have college or even high school degrees? Good question. We had a prominent columnist I know who explored that issue with us not too long ago, who's been in the news.
Yeah, I think, you know, and I saw some questions in the Q&A too about how do you tease out these different factors. And, you know, we have done some reporting where we have done a multivariate analysis. So, you know, for the non-statisticians, that means you put a bunch of things into a model and you say, well, okay, if being a Democrat predicts being vaccinated and having more education predicts being vaccinated, what it does being an educated Democrat. We do find there is an independent effect of education, even when you control for these other things. You know, another question that comes up is living in a rural area? Is that just because more Republicans live in rural areas? Is that why we see lower vaccination rates there? And actually we find that no, when you control for multiple things, there is something about living in a rural area, in addition to the higher share of Republicans who live there, that is correlated with lower vaccination rates.
With all that said, though, and Liz, you should also note that what we have seen over time, and that as people got more and more comfortable with getting vaccinated, as they saw their friends and family more, safely get vaccinated, as other things changed over time, the impact of partisanship has grown. So that is earlier on in the vaccination effort, education and location mattered, as much or, a little bit less than political identity. By the end now, when we're running those models, as Drew said at the beginning, the strongest predictor is by far whether or not what your partisan position is on these issues.
A number of questions asked, I think, very appropriately. Well, we've talked a lot in our work about different subgroups of the population, but these are not homogeneous groups, obviously. Latinos, Black Americans, and other groups that we talk about, neither are white Americans homogeneous. So what about that? And what can we say about that?
Yeah, I will start with the acknowledgement that yes, we recognize these are heterogeneous groups, and we want to speak with as much detail as we possibly can. And that's why we're doing oversamples of Black and Hispanic adults in these surveys. We wish we could also do other groups like Asian Americans and Native people. But even I should also acknowledge these are some of the hardest groups for us to reach in our surveys. And so with the oversamples that we're doing, it allows us to paint somewhat of a picture, but not as detailed as we would always like. We did do one survey in particular where we did an extra oversample of Hispanic adults, and we're able to break things out among those groups by income, by immigration status, by those who were fluent English speakers versus those who were taking the survey in Spanish, and really were able to show, particularly when it came to concerns about having to provide documentation to get a vaccine, or having more information needs, more questions that had to be addressed before being comfortable with vaccination, that even within the Hispanic community, there was a lot of variation. Molly may have something to add too.
I do. I just also wanted to remind everybody about, I think it was Liz's third chart, which showed the share of, among each group, the share that was vaccinated or still waiting to see or definitely not. And what we've made the point continuously since we started this effort is that no group is monolithic in its vaccine intentions, and that we've worked hard over time to try to tease out, it's important in that chart that there are definitely nots in every demographic category in America. So even though Democrats are the most likely to be vaccinated, there is a share of Democrats who are not getting the vaccine. Even though Republicans are the group that is the least likely to be vaccinated, more than 6 in 10 of them are vaccinated. So I think the questions are incredibly relevant and right. And we can look at, through crosstabs and other sort of data analysis approaches that we've done, to look at the differing reasons among those groups who say definitely not. So the reasons that some groups are definitely not is different than the reasons other groups are. And you can see that throughout many of our reports, and we're happy to follow up on those kinds of things.
Okay, switch to a bunch of questions that basically are about sources of information for people who are unvaccinated. What are they? What can we say about them?
That is a great question. And we did address that somewhat in our report on misinformation. First of all, let's just say that who is the most trusted source across the board, regardless of vaccination status, or political affiliation, and that is doctors, whether it's pediatricians or your own personal doctor. They're, number one trusted source above the media, above public health officials, above the CDC. But across the board, we find that for each source of information, unvaccinated adults and to a certain extent, Republicans compared to Democrats are less likely to trust any source of information. So I think those are sort of two important themes. And also, when it comes to some of those official sources of information, so we've asked about the CDC, the FDA, and individual spokespeople like Dr. Anthony Fauci. Trust in those sources has declined somewhat overall over the course of the pandemic, and it's become more politically polarized. So we found that Republicans in particular are much less likely to trust Dr. Fauci, and that gap has gotten bigger over the course of the pandemic. And then, it's much tougher to tease out the news media sources of information because we do have such a polarized and varied news environment. People tell us in surveys that they don't trust social media as a source of information on COVID-19, but we know from other sources that they're getting a lot of information from social media. And so it's hard to tease out what the influence of that is. But we did find in our misinformation report that people who believed a lot of misinformation were more likely to trust certain conservative news sources, including Fox News, One America News, and Newsmax, compared to people who held more accurate beliefs were more likely to trust some of the mainstream news media sources.
Another set of questions focus on boosters, which we haven't talked about as much as we probably should, given the focus on boosters. And they basically reduced to the question, what's the deal with boosters? Why are we not seeing more people who have been vaccinated getting boosted?
I'll start and then Liz can follow up. I mean, I think one thing we have to keep in mind is that some people just really weren't eligible for boosters, right? Yeah. So one of in Liz's slide where she showed the sort of the glass half full and the glass half empty, even in the half empty side, when you look at it by boosted rates overall for each of the subgroups, among the elderly, we're really looking pretty good, right? So the seniors, people who are at most at risk of serious disease from COVID-19 in all of its variants, are the group that is most likely to be boosted. And if I remember correctly, we're well over half. I think we're up to about 2/3 of that group overall, and that's even including the unvaccinated in the base. Some of the other reasons, so a big chunk is not eligible yet, and that is a big factor. Another factor is this case about, do I really need it? Do I really want it? So some of the folks who were kind of more reluctant to get vaccinated in the first place, they're like, hey, I did it, and people are having breakthrough infections and I feel like I'm already protected, or I already got a breakthrough infection. Do I really, really need this booster? So I still think that there are some real questions among people, particularly younger people, particularly healthier people, about whether they necessarily need the booster. I think we've seen some of those questions asked from our public health experts. And, there's been differing opinions about that and differing information. And it comes back to some of the confusion that is out there. The scientific community very appropriately has not been able to speak with one voice on all of these issues because there is differing opinions and the science is still evolving. And that does make it harder for people to know for sure how to answer the question, is it right for me or not?
Yeah, I would also just add that let's remember, there are it can be difficult for some people to get the time off of work to go get their booster. Maybe they got really sick with their first shot. And, so each time you're asking people to go, take another time to go do this, they're having to jump over these hurdles again. And if feel they're relatively young and healthy, it just may take a little bit more time.
Another topic that I thought would come up more is testing. And there are a number of questions on testing. Basically, it's what have you found about testing, difficulty getting testing, the different kinds of testing. I think you know where to go with this, so I'll just tee it up that way.
Yeah, I can take that one. We did ask about this in our January survey, which again was in the midst of this Omicron surge, and we found that it was the at-home tests that were particularly difficult for people to get. So people who said they tried to get an in-person test, most of them said it was relatively easy to get, although about a third did say it was difficult to get an in-person test. But for the at-home tests, about 6 in 10 of people who tried to get them said they were difficult to get. You know, the interesting thing there, I think, was that we found that it was actually higher income people who were more likely to say they had problems getting tests. And that was often because they were the ones who were seeking out the at-home tests, as opposed to people with lower incomes, if we think about who was having difficulty.
Okay, last question for questions is, have we had difficulty getting unvaccinated folks to participate in the survey? There are a number of questions about, we don't have time to get into this and shouldn't, but you know, how do you actually do this kind of survey research? But I'll focus it on that one question.
Well, we'll have a separate webinar on that one, and we'll have to have Ashley Kurtzinger on here, who's our Director of Survey Methodology, who could certainly talk for an hour about that. I mean, it is difficult to get all sorts of people to answer these surveys, but we at KFF are really committed to doing these in a way that is as inclusive as possible. And so we go to great lengths to include the communities that we talked about. So just, you know, one example of things that we do with our telephone surveys is we include oversamples of people who have pay-as-you-go cell phones, which means we're going to get more lower income people who don't necessarily participate in surveys in our samples. We work with our data collection and sampling partners at SSRS really hard to do this and be inclusive. And we keep an eye on what our samples are looking like and who is answering the questions, who's participating. At this point, we haven't had a particular problem with getting unvaccinated people to participate, and we try not to ask that vaccination status question right off the bat in our surveys. That's one way to kind of warm people up and get them to participate.
It might be a 2-hour seminar if we did it.
At least.
All right. Would any of you like to make final comments about anything related to today's subject? Or where we are now as we enter, we think, this period of endemicity?
I would just like to remind everybody just how dynamic this has been and probably will continue to be. And I'm not sure I've ever been part of a data collection effort over this kind of short period of time that has ebbed and flowed so much. The information, the change in just the virus itself and the new variants and the policies around it and the public health mitigation strategies around it. This has been an extremely dynamic, challenging time for the nation. And I think you can see that story play out through our data and our surveys over time. I think these kinds of efforts are really important to help paint the picture of what's happening at a point in time. But I also think there's going to be some really important lessons learned from this period to take forward for the nation, and some real areas that we're going to need to really work hard at. These areas of trust, of communication, of the polarization and the impacts of that going forward. So I'll just end on that. There's lots of work to do.
Anyone else? Okay. Thanks so many of you for sticking with us for the full hour. I hope we can see you at some in-person events in the not too distant future. We will stick with the monitor. We will stick with all of our COVID activities across the whole organization as long as there is a need for them. And there will be a need for them for the foreseeable future. So thank you again. We'll see you next time.